Post-SSRI Sexual Dysfunction. In this video I will show you how PSSD affects hormones like prolactin, estradiol, DHT, and how to reverse it. Okay, so the similar effect can also have high dose of ashwagandha. Okay, so we are not talking about just SSRIs. Okay, also ashwagandha, even some antibiotics can cause the same issue. Okay, so let's talk about hormonal effect in PSSD. And guys, honestly, I had many questions about how PFS and PSSD is similar. Okay, but there are only similarities in epigenetic changes, but there are no same epigenetic changes. Okay, so maybe only the same is that your gut is missing one strain of bacteria that is creating sodium butyrate, and sodium butyrate is HDAC inhibitor that can reverse epigenetic changes. Many guys, they don't believe me, but I don't care. Okay, it's like it is. Okay, you can take valproate, you can take any other chemical thing to restore your things, but epigenetic changes are not the same, because in PFS we are talking about neurosteroids, especially allopregnanolone, and here we are talking about restoring normal serotonin levels and dopamine. Okay, because hormonal effects in PSSD, okay, the first thing is prolactin. Okay, so prolactin is increased due to two things. Okay, so the first thing is direct effect on serotonin receptors in the hypothalamus. Okay, so we are talking about 5-HTA1 receptor. Okay, and this whole overexpression and downregulation of this receptor. Okay, so we are talking about heteroreceptor that is not working properly. Okay, and this is causing high prolactin levels because we are also blocking dopamine. Okay, we have excess of serotonin, but we are blocking dopamine. Okay, so you know that dopamine is also responsible for starting an erection, and is also really important for motivation, drive, and so on. Okay, so, and high prolactin, guys, high prolactin can also decrease your hormones like testosterone, because high prolactin over a long period of time will create hypogonadism. Okay, and high prolactin, what will also cause, will block 5-alpha reductase. Okay, but it's because of the prolactin. Okay, so in PFS the mechanism of blocking 5-alpha reductase is different. Okay, so therefore you have two different treatment, guys. Okay, in order to understand that probably you will not fix PSSD with the fix for PFS. Okay, so, and many guys, they also, after they stop taking PFS, the doctor recommended them SSRIs, and they took SSRIs and they have even worse side effects. Okay, so estradiol, okay, even there is estradiol changes in PSSD. Okay, so SSRIs can affect estrogen levels directly by altering SHBG. Okay, so, and this can lead to changes in free estradiol. Okay, and this of course impact libido and sexual functions. Okay, also we have dihydrotestosterone. Okay, dihydrotestosterone is really important for erection quality, for nitric oxide in your penile tissue, for smooth muscles in your penile tissues. Okay, so, and the problem is that that this is caused by blocking 5-alpha reductase. Okay, I explained you already what is the cause, because you have, if you are taking SSRIs, you have high level of prolactin, and prolactin is blocking 5-alpha reductase, and this is blocking creation of DHT from your testosterone, and also prolactin prolonged for a long period of time will also decrease your testosterone, so you will have less testosterone to convert to DHT, guys. Okay, so I see it in blood results from my clients. I have seen tons of blood results, so I am not talking you any bullshit. This is a real situation. Okay, so how to lower elevated prolactin? Okay, so for example, tribulus is one of the things, okay, that can lower prolactin. Okay, but sometimes you need stronger intervention, okay, than just tribulus. Okay, tribulus will increase DHT, okay, will increase DHEA, and will block prolactin. Okay, so but we want to also increase the reward system. Okay, we want to increase dopamine, but with this unbalanced state of serotonin, we are creating dopamine antagonizing. Okay, so we are blocking dopamine. Okay, and yeah, there are some dopamine agonists, okay, like cabergoline or bromocriptine, but they are only mimicking the action of dopamine. They are not fixing the issue. And from my knowledge, okay, and also from some studies, the issue need to be fixed with antagonizing 5-HTA1 receptors, autoreceptors, okay, in order to create a normal level of serotonin. Okay, so this is, you can do this with beta blockers and with specific antidepressant, okay, but also here there are some anecdotal evidence about HDAC inhibitors, okay, just for epigenetic changes, because there is overexpression in autoreceptors, okay, but I think this is only support supplementation for this, okay, so I think the main issue is this overexpression of these autoreceptors, okay, and you can really reverse it with beta blockers and with some antidepressants, okay, so, and also what you can do beside these things, okay, you need to really fix it, because you will have still high level of prolactin, or you will have a high level of serotonin that will block your dopamine, okay. You also need to fix your low androgens, because your low androgens also need to be improved, like DHT, because DHT, if it's low, it will have negative effect on androgen receptors, okay, so, and also, for example, low DHT can have effect on your penile tissue, nitric oxide. Then you can also use pharmacologic intervention to support your blood flow to your penile area. Okay, you can use tadalafil, Cialis. Okay, but also you can restore your nitric oxide synthase with things like pycnogenol. Okay. Also, tadalafil, small doses with pycnogenol work in synergy, okay? So, ADAC inhibitors will be only supporting treatment for this. We need to fix these hormonal effects in PSSD, like changes in prolactin, estradiol, and DHT levels, okay? So, and like I said, the first thing I would focus on is to restore normal functioning of serotonin by using beta blockers and that are antagonizing this 5-HTA1 autoreceptor. Okay, so this is not a medical advice. If you want to learn more, you will find more details in the description. Okay, and talk to your doctors about this and this treatment. Okay, see you, bye.